How do you reverse type 2 diabetes? Can everyone do it, or does it only work for some people?
So the whole question of the reversal of diabetes is such an interesting one, because most people who have been through medical school, been through nursing school, been through dietetic school, learn that diabetes is not a reversible disease. And it's probably only been in the last maybe 15 years that that's been on our radar, maybe 20. I think James Anderson's work in the 70s and 80s gave us some hints that it was a reversible disease. But certainly many health professionals still believe that it's a progressive irreversible disease. But there are a couple of things they need to know. Number one is, in 2009, the American Diabetes Association released a paper defining diabetes reversal. And they defined it as, number one, people would be on no medications. Number two, they would have normal glycemic measures, normal A1Cs, normal fasting glucose. And number three, they would maintain this for at least a year. Now that's the part that's controversial, at least a year. Some folks will say 3 months is enough, 6 months is enough. But what we know is they need to be off medications and have normal glycemic measures. And if they have that, if they don't have a fasting blood sugar of 126 milligrams per deciliter, they're not diabetic. If they don't have, A1Cs in the diabetic range, they're not diabetic. And yes, it's true, they could become diabetic again quite easily if they revert to their old ways and regain the weight and so forth. But diabetes is a reversible disease. I have seen many people reverse this disease. And so how do we reverse it? Well, number one, we need to understand diabetes. Type 2 diabetes is a disease of insulin resistance. So in most people, the pancreas is still functioning, which is not true in type 1 diabetes, where the beta cells have been mainly destroyed or completely destroyed. And in type 2 diabetes, the beta cells are often still functioning. Now they can become less well functioning, and we can lose some over time because of this, constant overuse and trying to put out so much insulin to compensate for high blood sugars that the pancreas can literally conk out eventually. But for most people, there is function in that pancreas. So what we need to do is we need to reverse insulin resistance. So what causes insulin resistance? Well, insulin resistance, I think, is a function of several things. So one of which is overweight and obesity. Overweight and obesity cause inflammation because you get this production of adipokines or cytokines that are these inflammatory compounds, especially from your visceral fat stores, that contribute to insulin resistance. You get oxidative stress, which again contributes to inflammation and insulin resistance. And then the other two really key players are dysbiosis. Dysbiosis in of itself is an unhealthy gut flora, and you can get production of these inflammatory compounds that leak into the bloodstream. Your gut becomes leaky, and these things get into the bloodstream and again can contribute to insulin resistance and endotoxemia and all of these things. And then the biggie, which many people are completely unaware of, is called lipotoxicity. And this is the kingpin. So lipotoxicity is a situation where you begin to store fat in places where it should not be. So fat, we have this unlimited ability to store fat. And it is normally stored in our adipose tissue. And adipose tissue can just keep storing and storing and storing and storing. However, when excess calories are coming in at such a high rate that the body can't shuttle it off to the fat stores fast enough, it sometimes ends up worming its way into places it shouldn't be. Your liver, your pancreas, your heart tissue, and your muscle tissue. And that is lipotoxicity. When you store fat in your pancreas, it kills your beta cells. When you store fat in your liver, it makes your body highly insulin resistant. When you store fat in your muscle tissue, and of course, we all store some fat in our muscle tissue in something called intramuscular lipids. And if you're an athlete, you actually even have more of these because you need that fast burning fuel to be readily available to your muscles. But in people who are overweight and diabetic, they get so much fat shoved into their muscle tissue that their muscle tissue becomes very insulin resistant. And so the intramuscular lipids can actually block insulin signaling. And this is a huge issue. And so what we see is that as people begin to lose weight, start eating more healthfully, and their body fat comes down, the lipotoxicity starts to decline. And in fact, one of the first clues we had that insulin resistance could be, could be reversed was in people undergoing bariatric surgery. So they would undergo bariatric surgery and the weight loss would happen very, very rapidly. And within a week or two, their insulin resistance was gone because one of the first places that they would burn the fat off was from their liver. And once you get liver fat down, you restore insulin sensitivity. So that was clue number one. And then these groups started to say, well, I wonder if we could get the same thing if we just put people on a really strict, like super low calorie, 600 to 800 calorie diet, giving them these liquid beverages, and that's it. And sure enough, lipotoxicity came down and insulin resistance went away. And then the third sort of level of evidence we now have is people consuming these whole food, plant-based diets. And it's a more gradual reduction of lipotoxicity, but we see it. Dr. Joel Fuhrman did a study. It was a very small study, but these individuals in his study, I believe it was 62% or thereabouts, completely went off medications and reversed their disease. And we have a group that's working on a diabetes program online. It's called the E4 Live Diabetes Solutions. They're seeing numbers about the same in the 60-some% of their folks who are really adherent are seeing complete reversal of the disease. And so this is exciting news. And so we know that by following a diet that doesn't include a lot of processed foods or animal products, that we can see tremendous improvements and restore our insulin sensitivity.